Shalom, welcome. I'm Rabbi Robin Frisch, and this is the Mazel Pups podcast. If you're Jewish or Jewish, however you define that, and you love dogs, then this is the podcast for you. I have a very special guest today, Dr. Deborah Aronson. She is a veterinarian, and she focuses exclusively on palliative, hospice, and end-of-life care for small animals. She is truly a pioneer in this area. She also has certification in veterinary medical acupuncture, and she launched Mainline VIP in 2015, offering house calls for palliative and end-of-life care for all pets. Dr. Aronson has advanced her knowledge in providing spiritual and pastoral care by becoming a trained chaplain through Mainline Health at Lankenau Hospital. She's a national speaker and teacher for veterinary students, professionals, and the public on compassionate communication, palliative care, human euthanasia techniques, and pet first aid. Dr. Aronson is fascinating to me. When I learned about her and the work that she does with acupuncture, the fact that she has her CPE, her Clinical Pastoral Education training, we'll talk about that, and also that she does pet palliative care and euthanasia, which is something that can be hard to talk about, but very important for pet parents to know about. We're going to begin with our 4 questions. So I remember, actually, I had a vet for years who didn't have a dog, and I always found that funny, or a cat. And I always found that amusing, but I think it had to do more with her kids' allergies than anything else. So I want to ask you, do you have any dogs or a dog?
I do. And thanks so much for having me here.
My pleasure.
I do just want to clarify one little thing in the introduction. I teach humane euthanasia techniques, not human euthanasia techniques. That's an important difference to point out. Yes, right now I have 2 big dogs. They're both rescues. One of them is a border collie mix named Rascal, and the other is an American Staffordshire Terrier Rottweiler mix named Nava. She has a good Jewish name.
And how can I ask how you came up with the names?
Well, Nava was kind of a mess when we got her, and it I believe it means lovely in Hebrew, and so I was manifesting what she would become, and Rascal came with the name.
Okay.
Yeah. Good. But it suits him.
So one has a name that fits and one is an aspiration.
Oh, she grew into it very quickly.
Oh, good.
Yes.
That's always good to hear. So can you tell us a fun fact about each of your dogs?
Rascal actually has, I believe, obsessive compulsive disorder. He is very fixated on lights, and I think that might have been triggered from how he was brought up, and also as a border collie, he's very, very intelligent, and so we work with him, and he's come a long way in his fixation that we can now distract him. So he's a very good boy. Nava, before we got her, she was shot, and she is filled with birdshot and blind in one eye, but you wouldn't know it. She's not sensitive on that side at all.
That's great. And do they get along well?
They get along well. Yeah, they're
nice.
Companionable. They're not, they don't play together very much, but they get along very well, and I think that they give each other comfort.
Nice. And now I have questions about you. What is your favorite part about being Jewish?
I feel that being Jewish, it gives me a grounding, an identity, a part of a community. I know that I can go anywhere in the world and find connection with people. With the holidays and the ethics, it really speaks to me.
And speaking of holidays, what is your favorite Jewish holiday?
I mean, I gotta say Purim. I mean, it's a lot of fun. In high school, I was in Tel Aviv on Purim and went to the parade, and just to be surrounded by such joy and lots of silly string, and everyone was Jewish, that I was just floored by that. So I still love that. I make mishloach manot. I deliver them to friends. I deliver them from my synagogue. It brings people together.
It is a really great holiday.
Yeah.
So I want to obviously switch from talking about Purim to talking about, of all things, acupuncture, which makes sense with you. I believe I told you personally that my older dog, Bo, who's been hit by a car twice, his hobby was chasing cars, still would be if he could get out of the house faster and we couldn't stop him.
Yeah.
So we did some acupuncture with him. We did it about once a month, which probably wasn't enough. My vet's office, there was a vet who did acupuncture who came there once a month, and that was the only option to do it there. But I do think it was helpful for him for a while.
Yeah.
So I'm curious how you got into that in the first place.
Sure. So about 12 years ago, I developed a neuropathy in my right arm. And it took a little while to figure out what was going on. It turns out I had a compressed nerve root in my neck. And so I went through physical therapy and I got acupuncture, and it really helped me. And at that point, I graduated from veterinary school in 2001. And so I was looking to maybe learn something new, maybe, become a little more clinically focused in something. I had been doing in-home end-of-life care since 2008. And so when this happened a few years after that, I had to stop doing surgery in my regular clinical practice. It was affecting me. So it was very natural at that point for me to get my veterinary medical acupuncture certification to add that to my existing in-home practice.
And am I correct? I know when it comes to humans, you can become a certified acupuncturist even if you're not an MD. But with dogs or any pets, you have to be a vet in order to get certified to do acupuncture. Is that correct?
In Pennsylvania, that's the case. I'm not. Most states, I suspect that is the case, but I'm not sure because every state has its own laws. But in Pennsylvania, only veterinarians can become acupuncturists for animals.
And how has that been how has that experience been for, I know you can't, dogs can't tell you, but you can get a sense of what it's like.
It's been great. It's been really, really well received. And I'm not the type of person to do something if I don't think it's actually helping. And obviously every patient is different and everyone responds differently. But I've seen enough pretty significant improvements in my patients to know that it's always worth giving it a try. Yeah. I've seen dogs that, hadn't played with a toy in 2 years suddenly start playing with a toy, or they're walking better, or a cat that hadn't jumped onto the windowsill in 6 months jumps onto the windowsill. But I don't do acupuncture just in isolation. I also do myofascial palpations, medical massage, if there's certain medications, and being in the home environment, I can look around and maybe suggest some modifications to help my patients too. So it's more of a holistic approach.
And is there a period of time that dogs do acupuncture, or could it be ongoing for a long time?
Yeah, it varies. For a typical patient of mine that I'm starting out, maybe for arthritis, I usually recommend 3 to 5 weekly treatments just because there is a little bit of a cumulative effect. And then we start spacing them out. And I have patients who I've been treating for years and years and years, on a monthly basis. I have some where I get a call, maybe once a year. Oh, my dog needs a tune-up, and I go over there. And I have others that we, give it a try, don't really feel like it makes a difference, so then we stop. I'm not going to continue if we don't feel like it's helping.
And how do most dogs react to acupuncture? Because it is sticking little pins into a dog.
It
just
is
like a human.
It is. It varies. The needles are so tiny for the most part. They bypass the pain receptors. And most dogs we can kind of distract with petting them or giving them treats, using lick mats. I used to use frozen baby food that would keep them occupied for a long time. But if one of my patients just really won't tolerate the needles, I'm not going to push it. I'm not going to force the issue. There are other things that we can use that might help them.
As you're talking, of course, I'm thinking of my dog, Bo. And he's a real tough guy when it comes to chasing cars, but then he's like a real scaredy cat with other things. But I'm thinking, had we done it at our house versus at the vet's office, because I would go with him or my husband would go and we would hold him. And, exactly as you're saying, most of the pins didn't bother him at all. There were a couple places she would do it and then we would stop. Like she would take it out of that spot and say, that's too much for today. And he would eat a pretzel with peanut butter on it. And she had the snacks. But I'm just thinking what a difference it could have made, again, if he wasn't in a vet's office, which is already scary the minute he walks in.
Right.
As opposed to doing it somewhere he's really comfortable. It might have been a much more pleasant experience for him.
Yeah, exactly. Although, once in a while I'll have a patient that I'll say, you know what, the home isn't the right place. You need to be at a vet hospital where they have an assistant who can help hold and, maybe a dog is a little confident or protective of the home and that wouldn't be good for me to go into.
Right. Or maybe they'd identify the home with somewhere they have to get this done. Could be another thing. But
yeah.
I think for him, actually, the home would have been a much more positive experience. We'll have to talk later.
Yeah.
So in addition to acupuncture, I want to turn now to CPE, which is Clinical Pastoral Education.
Yes.
Something I know about as a rabbi because it's very common for clergy to go through Clinical Pastoral Education.
Yep.
It is I just want to say, a very serious, intense thing. I believe it's about 400 hours when you take into account the learning and the time that you're spending working with patients and working in a hospital. When I think of CPE, I tend to think of clergy doing it. I'm certainly not veterinarian, so I would love to hear from you why you decided to do this, and we'll go from there.
Sure. So with my in-home work and also with my clinical work also, all veterinarians deal with a lot of end-of-life issues. And not just supporting our patients, but a huge amount of supporting our clients, the families, the caretakers of our patients. We're dealing with anticipatory grief, because most owners will outlive their pets. And then we're dealing with disenfranchised grief because a lot of people in society don't understand why someone might get upset when their pet is sick or has passed away, right? I mean, sometimes even within their own family, there's some conflict. And sometimes there's also complicated grief. We don't know the attachment someone has with their pet or other issues that make it difficult for them to heal from the loss. So as time was passing with my in-home and my palliative practice, I came to realize that what we as veterinarians offer is often something called pastoral care, right? Supporting other people during times of grief. But veterinarians have very little training in that, right? Very little. And there's also a mental health crisis in the veterinary field, with very high rates of suicidality, burnout, and leaving the profession. Veterinarians and veterinary technicians. I'd been doing this for a while, and I feel like I was actually doing a pretty good job. I gravitated towards this. I loved my silver whiskered patients. I loved the quality of life conversations. I was using humane euthanasia protocols that I felt make the experience really beautiful. But I saw that there was a need in the veterinary field for tools for vets who maybe it didn't come very naturally for. So that is actually one of the reasons why I took this CPE class.
Guys, did you have to take just a few months off from your practice, or were you doing everything at once?
I was very lucky. I was very privileged to be able to work part-time during this. I worked 2 days a week at the veterinary hospital where I had been working for a long time as a general practice associate. And my house call practice is very flexible. It's my own practice. I could schedule around things. But yeah, the unit of CPE, it was about 20 to 25 hours a week in addition. So yeah, I mean, I was working 50 to 60 hours a week for a few months. My kids were older, and so I was able to do that.
I just have to ask, did any of your colleagues in your group say, like, wait, you're a vet? What are you doing here?
Oh, everyone. Okay. Yeah. My cohort, there were 7 of us. It was through Mainline Health. And then my placement, my internship was at Lankenau Medical Center. My instructors, my preceptors, my classmates, they all knew I was a veterinarian. And it's not something I advertised in the hospital. Right. But the spiritual support actually came very naturally to me. And I really enjoyed my time there, and I learned so much. And, the religious support, because I'm Jewish and most of the families I was supporting were Christian, that was definitely a very steep learning curve for me. But it was an incredibly transforming experience. And so from that, I was able to bring tools back to my own practice. But then I've also successfully, brought them back to the veterinary field. And I've been doing some teaching, presenting at conferences and schools and that kind of thing. And it's been really, it's been great to be able to bring that back to my own profession.
I'm so glad you said that, because one of the questions I was just going to ask you is, this time I'll say humane end-of-life treatment. And sometimes, it sounds like we're more humane to animals than to humans, but that's another discussion. But this humane end-of-life treatment for animals isn't something, at least for me, that I hear about a lot. I imagine you're still somewhat unusual in this field, and this is new-ish, or becoming, I think, a direction we seem to be headed in.
Yeah.
So it feels like the CPE, not that every vet should have to go through CPE training, but aspects of it can be really helpful. And do you see, in the years ahead, that some of that could be integrated more regularly into the training of veterinarians?
Oh, for sure. And it is already happening. And you're right, it is kind of cutting edge. But for example, the University of Pennsylvania Veterinary School, where I went, they completely redid their curriculum about 3 years ago. And I came on last year, and I'm doing it again this year, and completely changing, making it a little bit more robust, training the students on palliative care and humane euthanasia techniques and grief support and that kind of thing. They have a whole separate communication skills instruction class, which I didn't have as a vet student. So they're certainly trying, but there is a real need, because what I have found over the years, and this is something that my talk that I've been giving tries to help with, is that the people, the veterinarians or the vet techs who are really good at protecting their emotions during difficult situations can come across as having poor bedside manner. They can be cold or clinical, abrupt. They might not be making eye contact, things like that. But on the flip side, a lot of people go into this field because they have a lot of empathy. And so then if they're not skilled at protecting their own emotions, that can lead to emotional burnout. And so the goal of this one particular talk that I do, and some of the other training that I provide, is to bring it all into balance, to get someone who can come across as being empathetic and a real, compassionate person, but doesn't stay in that pit with the owner and can't get themselves out of it, to maintain their emotional boundaries.
It's so interesting you say that, because as a rabbi, and my husband's also a rabbi, but I have a small congregation and they're older. And during COVID, I lost several congregants. And many were in their 90s, but there were people I'd known for years and cared about as human beings. And often when one would pass away, I was preparing for the funeral, and I would cry. And my husband would say to me, "Are you very protective? Are you okay? Is it too much for you?" I said, "No. As a rabbi, the minute I stop feeling sad when I lose a congregant is like when I'll get out of this.
Right.
Like I want to care about them. But there's also a point where if it became unhealthy, and my grief took over as if I was losing a family member every time I lost someone, that would not be productive for me. So I'm curious for you, the CP, it feels like to me there's 3 levels almost. There's the level of the support for the animal, the level of support for the person or people you're dealing with. And then there's also got to be like, how do you walk out of humanely bringing an end of a life to someone, even to an animal, knowing you're doing the right thing and being so kind? It's got to be hard. And you've seen the person's grief as it's happening.
Yeah.
So there's what can you do for yourself?
Exactly. And that's very true. And in a regular general practice, it can be a roller coaster ride because you might not have time to recover from that. And, you go from euthanizing an animal to going into a new puppy visit. And that's just, it's a huge roller coaster. And then there are other situations that vets find ourselves in, like working in a shelter or with behavioral euthanasia, of an aggressive animal, or working in an emergency room where there's, trauma and financial concerns and things like that, where we can experience, I think the term is moral distress, where you're doing something that you actually don't feel is right, but you have to do it. And absolutely, that's part of the reason why this is a real tough field, because there are those layers, and how do we move, navigate through them and stay positive.
So it's interesting you brought up the issue of money, because it's expensive taking care of dogs. And I heard something yesterday, like years ago, people would actually put their dogs to sleep before going on a vacation sometimes because they didn't want to have to pay for the care. I don't think that would happen today. I can't imagine any vet would do that. It doesn't seem very humane today.
Yeah.
And I imagine it's part of something I've talked about with other people for this podcast. We're at a different time, certainly, than when I grew up. My dog was my dog. We loved him, but he wasn't part of the family. No one ever referred to Kugel as part of the family. My dogs are part of, at least in my opinion, I don't know if the other ones in my family would agree. They are part of my family. I love them. I would do whatever I could do within reason to keep them alive if it was the best thing for them. Mm-hmm. But it can also be very expensive if they need surgery. I see people I've connected with on Instagram with dogs whose dogs have cancer. So what do you do as someone who wants to do the humane thing? If someone says, look, I can't afford X thousands of dollars, even if you, like, palliative wise, they could be okay.
Right.
Do you feel, what is your obligation in those cases?
Well, I mean, I don't know if it's an obligation. Well, backing up a little bit, there is pet health insurance. Mm-hmm. It's not something that I necessarily say everyone should get, but it's definitely worth looking into, and that can be very helpful for some people. One thing that I brought from CPE, and actually preceding CPE, I got from Musar, which is what started me on this journey, is other people are not failed versions of me. And it's important not to judge. I don't know everything that's going on in people's lives, and there are a lot of considerations that go into what's called quality of life. Mm-hmm. There's quality of life for the pet. There's quality of life for the family. And believe me, you talk to another veterinarian, you'll get another opinion. This is just my opinion. But there are worse things than death. And so I have euthanized animals that, have a terminal disease. Maybe with really intensive treatment, they could have, a few weeks or months. And the family doesn't have the resources, either, financial, emotional, physical, that they say, no, this is, mm-hmm. we can't do this. And they're making that decision out of love for their pet. Just because someone makes a decision for financial reasons doesn't mean that they don't love their pet any less. Mm-hmm. And that's actually something that I have told other veterinarians as well. I respect people's decisions. Have I turned down euthanasias because I feel like I'm, ethically, I'm not comfortable with that? Yes, of course. I'm in a position that I can do that. Mm-hmm. But this is euthanasia, it's a permanent decision. And I haven't known anyone to take it lightly. And if that means that it's because they don't have the financial resources, that's still not a light decision. And for me, it's still a valid decision.
So euthanasia, I think typically when you do it is because you do travel, is in people's homes.
Yeah. Yep.
And which I would imagine, for me at least, would be comforting when that time comes. So what is it like? I know everyone's experience is different and every dog's experience is different.
Yeah.
But do the people typically stay with you the whole time? Do any of them kind of participate in any rituals of their own, or have they thought about it before you come, or is it just so overwhelming that you get there and then they're like, I'll see you when you're done?
It varies in the home environment. So first of all, I always touch base with people before I go to their homes, and I have them at least think about what they might want for aftercare, to start processing, and planning and to control certain things. And then I go over everything when I get there too. And most of my clients do stay. My visits are usually pretty long, 45 minutes to an hour or so. I do use a multi-step process where there's sedation and anesthesia before the euthanasia itself. I describe it as a river slowly running downstream, just getting deeper and deeper. And my goal is to have the process be as peaceful as possible, and controlled, but not necessarily, fast. Right. So most of the families stay with them the entire time. They can be on their lap or whatever. Sometimes people aren't comfortable with that, so then they'll stay just while the sedation, right? And then when their pet's asleep, then they'll leave the room because they don't want to be present for that last injection. That's fine. I have certainly gone to people's houses where they've said, the cat's in the other room, I'm not coming anywhere near it. And I respect that too, right? I treat my patients the same. I don't know what's happening, in these families,
And presumably they've thought it out.
They've thought it out. They've made the decision. I go over everything. I always welcome people to be present, but I don't force it on anyone. Yeah.
And then after the animals passed away, I imagine for some, not for everyone, they might want some time just to be with their pet. And then do you take the pet with you?
I can, yes. So I always offer privacy after death. I have a stretcher for larger dogs. I use a basket for smaller dogs or cats in my car, and I leave it in my car. So I offer them privacy to step away. I step away. I have grief support materials that I leave with every visit, so they have something to read, some resources to tap into that they might not be able to process while I'm actually there. I also have resources on my website, but not everyone thinks to go online, so it's just a paper version. I can do certain memorial products in the home, a lock of fur, a paw print, that kind of thing. And then sometimes, depending where they live, they'll keep their pet for burial, in which case I have an additional form that they need to sign, just because euthanasia solution is toxic to wildlife, and I have some additional instructions for them. But otherwise, yes, I handle aftercare. I work with a pet crematory that if they want the ashes back, they can get the ashes back. And if they don't want the ashes back, I actually just found out that this crematory, the communal ashes get sent to the Jersey Shore, where they are made into coral reefs.
Oh, that's cool.
Which
is
amazing.
Good.
I think that's amazing.
That's very nice to hear.
Yeah. But I can also transport pets to other, if they want to use a different aftercare center, I can help with transportation also.
Wow. And we touched on this a little, but knowing that you've studied Musar, like Jewish ethics, and you've taken the CPE, and you're human, And it is hard going through this, I imagine, over and over. Is there anything you do, like when you walk out of a home for yourself?
Yes. Breathing is the best thing I can do. And this is something that I started doing even before I took the CPE and learned more about mindfulness and meditation and that kind of thing. And I called it a reset. Mm-hmm. And it wouldn't take very long. I would just stand in a corner and close my eyes and take a deep breath. And I'm big on visualization. So I would visualize my agitation, my cortisol levels going down and just leveling out, just a quick reset. Now that I'm not in a busy clinic, so my pace is a little bit slower, I'll take a couple minutes in my car just to take a couple of breaths. Oftentimes, before I go home, go into the chaos of my regular life, I'll just take a couple of minutes just to settle myself, and that helps. But remember, I loved this work, so I think I'm pretty good at not holding on to other people's grief. And I developed a visualization that I've shared with a lot of vets that I visualize I don't have a wall up, but I visualize the grief or anger or whatever emotion coming into me, and then an internal chemical reaction converting that grief to compassion, which I then give back out as empathy. So I let it flow in and flow out and flow in and flow out. And but I'm not going to deny that, if I've had 3 euthanasias in one day, I'm wiped.
Yeah, that's intense.
Yeah, I'm wiped.
And then I'm sure you come home and your family, like your wife and mom, they haven't experienced what you've experienced all day.
Yeah, which is why I take a moment for myself before coming in the house. Yeah.
So, and you did mention earlier that there is a high level of suicide for veterinarians and vet techs, and I know that you're involved with I don't know if it's an organization, but helping with that. Can you tell us a little bit about that, and if that's related to what you're talking about, or it comes from other things?
Sure. Well, veterinarians have 4 times the suicide rate of the general public, and it's actually worldwide. It's multifactorial. Certainly, dealing with heavy emotions as part of it, access to humane euthanasia drugs, and a desensitization towards death as part of it. The financial situation, the average new graduating veterinarians, the average debt load is about $300,000 now, and the pay is not equivalent to that, and so there's a lot of financial stress in the field as well. And so I volunteer. Before I did CPE, I started volunteering for a group called Not One More Vet, NOMV. Oh, wow. It started as a Facebook group back in 2013 after a very renowned veterinarian named Sophia Yin, may her memory be for a blessing. She died by suicide, and she invented the whole low stress handling, fear-free techniques that a lot of veterinary hospitals are certified in now. And it came as a shock to the field. And so a Facebook group started, and then it became a nonprofit, and then they have lots of different support modalities in place, I would say, including financial grants and support groups. And so I volunteer for a platform, an app called Lifeboat, which is an anonymous peer support platform. It's asynchronous. So basically, I'm put in a group. There's they're called pods, and then the support group, there's 3 of us. We're called a pack. And so each pod has 1 pack and then a peer who's getting the support. And I went through their peer training, which actually came from the human side of peer training. And so I've been involved with that for probably 4 or 5 years now, I guess. Yeah. And that's been great. And we can't fix anything, but so much of it is just listening. Mm-hmm. And I've helped people worldwide. Right now I'm communicating with someone who's in Ukraine.
Wow.
and is dealing with some stresses over there.
So what advice would you give to, first of all, someone thinking of entering vet school? Would you say it's worth it?
For many,
I know every person's different. Obviously.
Every person's different. Yeah. For many years, I went to a career day at a local high school, and I was all gung ho, and then I stopped doing it because I got to admit I got a little bitter about it. But then I started again with the goal of just having people's eyes be open, to understand what's involved, what's at stake. The field has changed significantly since when I graduated. There's a lot of, corporations that own vet hospitals. And, sometimes that's positive, sometimes it's negative, but people should just be aware. I'm not going to tell someone not to go if that's their passion, but they need to be informed and they need to know what they're getting into.
And so what about someone who's a vet or in vet school who says, I want to do what you do. I'm really interested in this idea of working with humane end-of-life treatment. Is it something you would encourage them to do or specific advice you'd give them?
Oh, sure. And that's something that's already happening. I've been approached by a few people asking for mentorship, which is kind of like a newer thing in the veterinary field, that the early career vets are they're asking for that kind of thing. When I speak at a conference, people come up and ask me. There's a lot of additional training to go through. There are groups specifically for veterinarians or veterinary technicians who want to learn some of those skills. I do training. It's a fun thing, and it's been really rewarding, and everyone I know feels very rewarded by it. It's not the highest paid clinical focus in veterinary medicine. So people do need to be aware of that, but it's also something that people can add, like I did on the side, work as an associate and then offer end-of-life visits, when they're not working in the clinic. It's an easy thing to add that can be really rewarding.
Yeah, as I would imagine, even though it can be emotionally difficult, like the reward is incredible.
Yeah, I get to witness the human-animal bond, at its most beautiful time. I feel really grateful to be able to offer this. That was one thing that I came out of working on the human side, that I just with an immense amount of gratitude at what I can give my patients.
You know what? I think if you found that in what you're doing for your work, you're a lucky human being.
Yes, exactly.
Everyone should have that. So is there anything else you want us to know about either humane end-of-life treatment or any of the work that you've done?
I think that it would be good for people to know what resources are out there for them, when they're struggling with the decisions. There's a group called the Association for Pet Loss and Bereavement, the APLB, which has a lot of good resources on their website to understand that, if they're not getting the support that they need, it is out there for them. And we get it, the people in the pet field, we get it.
Yeah.
Yeah.
So obviously not all of our listeners are in the mainline Pennsylvania area, but for those who are, can you share your website? And your website actually has great information regardless of where you are. I think there's very helpful information for people. So if you want
yeah, anyone can go to my website. I also do virtual consults. So I've done virtual consults all over for people who are struggling with, figuring out if it's time or not. My website it's not a great website, but it's Mainline VIP, MAINLINE VIP.weebly, WEEB as in boy, LY.com.
And I will put that in the show notes. So everyone will
yes.
also have, I wanted you to say it, but it will also be for those who want to look at.
Yeah, it's not a great website.
You can also search Dr. Deborah Aronson on Google and you'll find it.
Okay.
It's not that. That's how I found it originally.
Oh, good. Yeah.
So I want to thank you for being here. I mean, I'm so fascinated by the work you do. I think it's so important. I'm so grateful. Hopefully it not for a while, but when the time comes to know that this exists and actually exists locally for me, for my own dogs, it really does bring me a sense of comfort, especially with an older dog. Hopefully he'll have a few more years, but I want when that time comes to know that having lost one dog was killed by a car, so it was all very tragic and quick.
Right.
To know, hopefully with the others, when the time comes, that it can be done in the most meaningful, spiritual way possible. Yeah. So just, that's such a relief to hear that and to know that, and to know that there are people like you who are out there committed to not just doing this work, but to helping others doing this work, and to this whole field within veterinary medicine growing, as well as acupuncture and all of the other things you do. And thank you so much for being here. I want to thank our listeners and our watchers as well. Thank you for being here and for supporting Mazel Pups. Hope that, I'm sure you did enjoy this episode as much as I did, and I look forward to seeing you next week.
Hello, shalom friends. I'm Bo, one of Rabbi Robin's dogs and our original Mazel Pup. If you enjoyed today's podcast, don't forget to hit that subscribe button, give us a pause and 5-star rating, and follow us on social media. Thanks for listening.